Okay. So welcome everybody. Welcome to today's presentation of our 2025 United Way ALICE report about affordability challenges in our region. I'm Tina Julleret. I'm the co-chair of the League's Social Issues Action team. And we're really excited to be introducing our speaker for today, Dr. Nichole Peña-Miller. And she's the Director of Financial Security for United Way Suncoast. And she plays an important role in the community, helping create awareness of the challenges that folks are facing with regards to affordability and financial security, and works with us to help build the understanding to create programs to help folks achieve financial stability. So the presentation today, we're going to have a presentation by Dr. Miller that will take, about half of the agenda, and then we'll have plenty of time for Q&A following the presentation. What we'll do with the questions is just take them from the chat. So if you think of questions as we're going along or at any time, put them in the chat, and then we'll queue them up to be answered once the presentation is finished. So if there are no further questions, without further ado, I'm going to turn it over to Dr. Nichole Peña-Miller. So welcome, Nichole. We're just really excited to have you with us today.
Thank you for having me here. I'm excited to be here today, excited to share with you the most recent ALICE report. Excited to talk to you about the implications this has for this community and how we can work together and continue to collaborate to advance the well-being of our community overall. I know Tina said pop your questions into the chat. Tina and others who are monitoring the chat, if there's a question, feel free to interrupt me and just ask that question in the moment. I'm going to go through some data. I'm going to tell you some stories. I'm going to also go through a lot of charts. And if there's something that you're not sure about, ask me and we can pause and take a little bit more time on it, because this is a very data-rich presentation. And I want to make sure that you are getting something valuable out of it. So with that, I'm going to share my screen. And you all can see a pretty colorful presentation, right? Yay, I love it when that works. So as Tina mentioned, I'm going to be sharing our most recent ALICE report. We will be focusing on Manatee County because this is a League of Women Voters in Manatee County. But also I have pulled in some information from your neighboring counties just to see where Manatee compares to your neighbors to the south in Sarasota, as well as your neighbors to the north in Pinellas, and the state overall. And so we can see where we are and think about some next steps. So we get this question a lot. What is ALICE? Or who is ALICE? And so in order to answer that question, we first need to talk about the federal poverty line. The federal poverty line is a measure that many of us are familiar with. It's used in many cases to determine an individual's eligibility for services. And at its most basic level, we tend to think about the federal poverty line as this tool that measures the people who don't have enough to survive. But when we talk about ALICE and the importance of ALICE, we do it in part because the federal poverty line is a broken tool. It was created with a purpose. It has been used for other purposes since then. And as a result, we have a tool that no longer reflects the individuals who are struggling in our community. The woman you see on the screen is a woman named Molly Orshansky. And she is the individual who was generally credited with creating the federal poverty line. I want to be clear with you all, though. Ms. Orshansky is not the villain of my story. In fact, Molly Orshansky grew up and went to college, studied statistics, and was really interested in exploring the number of individuals who were struggling with food insecurity. She worked for a time with Health and Human Services. She then went to the Department of Agriculture, and she was tasked with determining how many people initially were struggling to have enough food on their table. And at the time, the Department of Agriculture had 3 levels of food security. A thrifty meal plan, which was designed for individuals who were experiencing a financial hardship and were cutting back on essentials, much like some people are doing today, cutting back on perhaps more expensive products and choosing cheaper products, choosing perhaps more vegetarian forms of protein as opposed to meats, which tend to be more expensive. And it was designed to be a temporary solution for an individual who was experiencing short-term hardship. Then there was the standard meal plan and a excess food plan. And based on these 3 categories, she determined the number of individuals who could not afford the lowest of those meal plans, who did not earn enough money to even afford basics. At the time, under the economical food plan, we knew that individuals were spending 1/3 of their household budget on food. So based on the data she had at the time, she said, okay, 1/3 of a household's income was spent on food. We should take that number, multiply it by 3, and anyone who makes less than that is living in poverty and cannot afford basic needs. That's how we got the federal poverty line, based on 1955's data that she used in the early 1960s and then continued throughout the 1960s to develop. And I want to stop for a moment. This is the audience participation part of the program, and ask you to talk about some of the things that have changed with households since 1955 or 1960. And anybody, feel free to come off mute and tell me some of the things that have changed.
Far more prepared foods.
Far more prepared foods. Yeah. What else has changed about our households and what we spend our money on? What our households look like?
It's taking a bigger portion of income.
Yeah. We have more categories for our income.
Both people working and having to pay daycare expenses also has done
Absolutely.
a good chunk of money.
Absolutely. When we think about what has changed, I have a friend who presents this, and when she does it, she has this photo of this woman carrying her groceries behind her, and she says, "Look at this photo of me carrying my groceries as I go home to then prepare a meal for my family." And the reality is a lot has changed. We have a real need for individuals to be 2-earner households, and we're going to see that in terms of the budget. So we have more people in the workforce. Importantly, I'm here talking to you all, and if this were 1960, most of us in this room would not be able to have a credit card or a bank account in our own name. Additionally, sitting next to you, I'm talking to you on a virtual screen with another screen over here, and I have a phone sitting next to me. All of these pieces of technology are considered ordinary and necessary for the work that I do. So we have entire categories of household expenses that didn't exist in 1960, and at least didn't exist in the average family's household. So while we've had these significant changes, and while we know that today families spend about 1/8 of their household budget on food, the federal poverty line has not changed. So while we're spending a lower percentage, we're still calculating based on spending 1/3 of the income. And so that's why it's a broken tool, and that's why we're advocating for something better. In order to do that, we want to introduce you to ALICE. ALICE is an acronym that stands for Asset Limited, So individuals who don't have a lot of savings are living paycheck to paycheck. They're income constrained and they're employed. And the employed is a key component because there is a myth or misconception in our community that individuals who don't have enough money to get by are unemployed. And Alice is in our workforce. So the Alice budget is a dollar threshold that calculates the expenses and what it means to get by based on current cost, geography, and family type. This matters because when we talk about the poverty line, we sometimes assume that if you don't live in poverty, if you are above the poverty line, then you are okay. The opposite of not okay is okay. And we know that there's this very large gray area between being in poverty and being okay. So that's part of where the Alice data comes in. It also takes into consideration, in addition to current costs, takes into consideration geography. I'm from rural Indiana. There's a Miami County, Indiana. We have Miami-Dade County in Florida. I can tell you the cost of living in Miami County, Indiana is very different than the cost of living in Miami, Florida. The cost of living in Tampa, Kansas is very different than the cost of living in Tampa, Florida. And the federal poverty line is flat across the entire nation and doesn't take into consideration that things cost differently in different parts of the country. The federal poverty line also doesn't take into consideration family type. So it does have a number. So it does count the number of people in your household. But based on the federal poverty line, a household that has 2 adult earners and 2 children counts the same as a household with 1 adult earner, a grandparent, and 2 children, or 1 adult earner and 3 children. All of those are calculated the same, even though the earning potential for those families is very different. So the Alice threshold takes into consideration all of those things when we consider what an individual and a household looks like. So we also want to note that while we're going to talk about Manatee County today, and I mentioned that I pulled in some stuff from Sarasota and Pinellas County as well, you can learn more about the Alice report by visiting our website and clicking on the link for Alice. You can see every county in the state of Florida. You can dive deeper into the entire state and what that looks like. If you want to compare what the cost of living is in Miami County, Indiana, you can go and look at Indiana's report and compare it to what it's like here. Spoiler alert, it looks very different. I have a family member who lives in Indiana and bought a house, and I can tell you that the cost of his house, which is very close to the square footage of my house, costs significantly less than what my house did here in Florida. So this is a reality that we live with. And so you can see the entire state of Florida. You can also see about 27 of the other 50 states in our nation. So when we talk about who is Alice, there's often a misconception that it's just certain populations, or that, yeah, there are some people who are struggling to get by in our community, but sometimes we are not able to think about the magnitude of the challenge. So in Florida, nearly half of households, or 47%, fall below the Alice threshold, with 13% of Floridians living in poverty and about 34% unable to afford a bare bones basic budget. Locally, in United Way Suncoast 5-county region, over 2 out of 5 households live below the Alice threshold. It's 658,000 people, or enough people or enough households to fill Raymond James Stadium over 8 times. So if you've been to a Bucks game or you've been to a concert, you know how big that stadium is. You could fill that stadium 8 times, just representing households that are struggling in our 5-county region. Within Manatee County, that's nearly 80,000 households, or enough to fill Lecon Park over 8 times with the number of people who are struggling in our community. So when we think about the magnitude of the problem, we can think about how many people that is, and thinking about that in terms of the faces that we see. Tina, when we met last week and chatted, asked me about how things have changed over the years. So United Way began tracking the ALICE report in Florida in 2010. So on the far left side of this chart, we have a nice bar graph, or I'm sorry, a line graph. And then we have numbers, depending on which way you like to look at it. When we look at that line, the darker blue line is those living in poverty, and the lighter blue line is the ALICE population. And what we can see is, even as the number of households that are living in poverty dips, we also see a dip in the ALICE population. But interestingly, in 2018, we see that the number of people living in poverty went down, and it had been on a downward trend, but the number of individuals who were ALICE, those people in that gray area, making above the poverty line, but not affording enough to make ends meet, spiked. And then since 2019, we've seen a steady increase in the number of ALICE households. So when we look recently at the last 4 years, we can see that the number of households has also increased. We know that there are more people moving to Manatee County, and while some of those individuals are above the ALICE threshold, the number of people, the number of households in Manatee County that are struggling to afford basic needs continues to grow and continues to multiply. When we look at Sarasota County as well, we see a very similar trend in the number of households that are below the ALICE threshold. So very similar in terms of percentage. We know from other reports that individuals are moving from Sarasota to Manatee County sometimes. It's a little bit cheaper to live in Manatee County. And we see that reflected in the data and in what our communities are facing. So I mentioned that the E in ALICE stands for employed. And that is one of the biggest misconceptions that we can work to correct. Using just the react button, how many of you, or physically raise your hand because I can see hands too, how many of you have heard something about low-income people not working or being lazy? Or I see those hands popping up, right? I once was giving a presentation and someone said, well, nobody wants to work. And the reality is ALICE is working, and they're working a lot. So among the top 20 occupations in the state of Florida, over 1/3 of employees are below the ALICE threshold. It's nearly 1.3 million people who are working, and working in the jobs that are most common in our communities, but are not affording enough, or are not earning enough to get by, and are not able to afford their expenses. We saw that for some jobs, the rates of ALICE in the workforce were pretty stable. So the number of cashiers, over half of cashiers are struggling to make ends meet. Over a quarter of bookkeeping employees are also struggling to make ends meet. But we saw an increase of the number of nurses It was 1 in 10 a year ago. Now 1 in 7 nurses is struggling to make ends meet in our community. And 1 in 5 elementary and middle school teachers is struggling to afford the basic necessities and live in our community. This is especially important when we think about where we were 4 and 5 years ago. The individuals who we cheered on as our pandemic heroes, who were the frontline workers, who were doing so much to care for our community, are unable to care for themselves and are bringing that stress with them every day to think about, how am I going to pay rent and get gas and get food for my household while I'm also taking someone's vital signs or teaching a child to read. So when we think about the face of Alice and who's in our community, serving our community, taking care of us, we can know that they are struggling. I'm going to give you a second to take this chart in. We've been told repeatedly that in terms of basic presentation techniques, you should not show a giant chart to people, and we do it anyway. There are over 120 boxes you could potentially look at on this chart. I'm going to ask you to look at the column that says 2 adults and 2 children in childcare. So it is the third column from the right. And we can see on this chart the basic monthly cost. These are basic needs that individuals need to get by. Individuals need housing. If you have 2 children in childcare, you need childcare. People need food. They need transportation. They need basic health care. Technology is a miscellaneous category for any minor cost overruns in any of the categories. Taxes. Alice pays taxes like everyone else. You see a monthly total, the annual total, and then the hourly wage that a household needs to make in order to survive. I will also share with you that this chart has grown over time. We started with just a single adult and a family of 4, and now we see different combinations. Beyond this combination, when I'm done sharing, I'm going to also share with you an Alice calculator that you can go in and play around with family compositions to see what a budget would look like for a specific family. But I call this one to your attention, the 2 adults and 2 children in childcare, because this is a common part of our community. We see that the most expensive part of living is housing. We know that in Manatee County, the average cost of housing in the last 5 years has gone up on average $350 a month. That's not just 1 month of having to come up with an extra $300, but every single month needing to spend $1,800 on housing. For a family of 4, that is very basic housing. It's a 2-bedroom apartment with below average square footage. That also includes utilities for that house. So when I think about the cost of rent and utilities, $1,800 seems like a steal, but it's also a burden. And we could think about what that housing looks like. Does it have the best insulation? On a hot July day, what does that house feel like? On a cold winter day, what does that look like? Where is that located in our community? And then the second biggest cost in a family's budget is childcare. Now, I am fortunate. My children are grown, and so I am not paying for childcare. But I can share with you that I have a friend who has children, and we were sitting around comparing. My daughter's tuition at a state university is cheaper each year than what my friend pays for childcare for their 2-year-old son. And that's a reality that our families are facing. Also, if you're really interested in this, on our website, you can see the methodology through which each of these things are calculated. Childcare is defined as the cheapest legal childcare in the region. It's generally a home-based childcare, and it often doesn't have a lot of the early learning components that we know are really valuable to make a child kindergarten ready. So we're talking about bare basics with each of these categories. That food plan is the thrifty meal plan, which is not designed for long-term usage for a family. It includes doing things like buying a bag of beans instead of a can of beans because it's cheaper. I don't know about you. I haven't even thought about what I'm going to have for dinner tonight, let alone think about and have the foresight to say, we're going to have beans for dinner tonight. I need to put those in a pan and let them simmer, right? That type of food preparation takes time. And when we talk about expenses, we often forget about the time that it takes to do those things. Likewise, the transportation category is one car that is paid off with liability insurance and gas for the month. So if you are a two-earner household, how do you navigate getting to your jobs with one car? Public transportation in Manatee County is not really feasible for most people. If that bus is late, you risk losing your job. And so that's what families are dealing with. I had a colleague at a job who opted to have liability only on her car because she was an Alice household and she needed to be able to find some cost-cutting measures in her budget. And she was on her way home from picking her son up from football practice and was hit by another car that went through a stop sign. She has liability only. That other person was uninsured. She was then without a car. Her car was totaled with nothing that she could do because she didn't have full coverage on her car. And that was a risk that she said, even though it was hard and it was a difficult situation for her, she would absolutely do that again because it wasn't feasible for her to have full coverage on her car. So then she's got to look at her budget and find a way to get another mode of transportation. And in each of those categories, one additional cost in one category throws off a carefully constructed budget and could potentially send a family into a tailspin. So what this means for Manatee County, it means that a household of 4 with 2 adults and 2 children in childcare need to earn about $95,000 a year, or an hourly wage of $47.50. Now, if you are 2 adults, that means that you each need to earn about $23.75 an hour, which is challenging in our community. But if you are a single earner in your household, you've got to come up with a job that pays $47.50 an hour. And in our community, there are not a lot of jobs that pay $47.50 an hour. So the reality for the families in our community is that this is hard. I'm going to pop over and share with you, just for some comparison, the same survival budget for Sarasota County. You see increases in housing, increases in childcare, increases in food cost. So we see an annual total that's about $10,000 more and a necessary wage of $52 an hour compared to $47.50. And so when we begin to ask why people might be moving out of Sarasota County, it's because they're looking for cheaper housing, more affordable childcare, and just any way to cut that basic cost. I started by sharing with you a bit about the federal poverty level and why it was a broken tool. This chart also helps us to understand where the gaps are and why being above poverty does not mean being okay. So on the far right, you see the federal poverty level for a family of 4 is $30,000 a year. For the 2 most common occupations in our community, personal care aide and a stock worker or order filler, both working full-time, the 2 most common occupations in the state would earn $66,000 a year. But across the state, the household survival budget for a family of 4 is $86,000. So there's a $20,000 difference between what 2 full-time workers do and what they need to afford basic needs. So then you start asking questions about how this family is going to come up with another $20,000 a year in order to make basic ends meet. Do they look at working opposite shifts to maybe lower childcare costs? Does somebody opt out of the labor force in order to stay home and care for a child if they can't find work? Do people work multiple jobs, working a full-time job and then going on to another job after that in order to make ends meet? In the state of Florida, we know that 3 out of 5 teachers in our community is working a second job. So that means when class is over and that bell rings, that teacher is going to do some other kind of work to make up for the gap in their budget. So what's different? What do we see now that we didn't see 2 years ago? What didn't we see 5 years ago that we're seeing now? And where do we go from here? The recap is that while there are more people living in our community, there are also more people who are below ALICE in our community and are struggling with those day-to-day expenses. We also saw an increase of 8% in household budgets over the last year, and we expect that number to continue to climb with inflation, with the cost of tariffs, and all of those things that are passed on to our community. And as I'm going to show you in just a minute, we see demographic discrepancies in who is doing okay and who is not doing okay in our community. I'm going to pause there just briefly and ask Tina, are there any questions in the chat that you'd like me to address now, or we can hold them?
I think a lot of them we've been addressing on the way, but one that we could take now or defer, whichever you prefer, is when you were showing the chart with the survival budget and then the wages. There was a question of how would that look if we raise the minimum hourly wage? And I know that's not a question that's easy to answer, but any perspective on that?
Absolutely. So full disclosure, I am not an economist. So I understand very vaguely and just enough to get myself in a lot of trouble to say that, if we raise wages, would that potentially cause inflation in other areas? I can't answer that question. What I can say is that this budget is a budget based on expenses rather than income. So we look at it and say, here's what it costs to afford bare basic expenses. And it's worth noting that if you're really interested, there's also a stability budget that we have that's significantly higher than this. So this is survival. There is a number that is much higher that would include things like having some savings for a family. And having healthcare for everyone in the household and what that would look like. So in terms of jobs, if you wanted to speak specifically to jobs, we would be advocating for jobs that pay a family sustaining wage. We know that some jobs in our community are going to exist and we're going to need them. We live in a tourist community, and so having hospitality workers is always going to be a need that we have. There are many creative solutions to this, from hospitality industries that are providing housing subsidies or on-site childcare that's at a lower cost, or any other tools to help our low workers and then also advocating for jobs and connecting individuals to jobs that do pay a family sustaining wage.
And a related question, Nicole, was, the definition of income constrained per se. Is it unable to meet that survival budget? Is that how we would frame that?
It is. It's unable to meet the survival budget. Also, when we talk about income, it's the constraint of the income. So perhaps unable to add more hours. I'm going to show you a chart in just a minute. And for a senior household, there may be a gap between Social Security and work, or between Social Security and the budget. How does a 85-year-old man enter the workforce? We spoke to somebody at an employer who was like, and our oldest employee is this great man who's 85. And people were like, yay, 85-year-old man working. And I was really disturbed by this because when my parents turn 85, I don't want them working. So it's those constraints. What are the constraints put on an individual? And what are the limitations that they have with their income?
Thank you.
Thank you. Thank you for the questions. Keep them coming. We're going to jump in with some charts and graphs. So I've been talking a lot. We're going to look at some pictures to go along with it. When we look at the state of Florida, the big takeaway from this is that we know that rural communities tend to have the highest rates of ALICE. Though in every city, we also see high concentrations of families and households that are below the ALICE threshold. So in this picture, dark blue means worse, light blue means better. So when we look along the coast in Manatee County and Sarasota, it is lighter blue. We do have a lower rate of ALICE than our peers in DeSoto and Hardy County. We have a lower rate of ALICE than those in Hillsborough County. But there are still a lot of people who are struggling. You can also, on our website, you can zoom in to our 5-county region. We can look at cities, and then even within cities, you can see gradations of that blue of zip codes where more people are struggling. So we're going to zoom in even more on Manatee County, and you can see in zip codes in Bradenton in 34205, 34207, 66% of households in zip code 34207 are struggling to afford the basic needs. And that's very different than when we look out in Lakewood Ranch at zip code 34202, where only 25% are struggling to afford basic needs. So as a legislative tool, this is also something that you can break down by legislative district. And at the very local level, in talking to our commissioners and talking to our local elected officials, we can talk to them about the areas where we know additional supports are needed for our community to support individuals. When we look at families with children in Manatee County, unsurprisingly, single-headed families, particularly single female-headed households, struggle significantly more than their married counterparts. So in terms of reading this chart, you've got the first 3 columns with the yellow, blue, and dark blue. Yellow is above ALICE. So that is the percentage of individuals who are making ends meet. Blue is the individuals who are ALICE, who are making above poverty and therefore likely don't qualify for federal benefits, but are struggling still to make ends meet. And the dark blue is individuals who are living in poverty. And then on the far right side, you see this gradiated gray chart. And that represents the composition of our community of the percentage of households that are single female-headed, single male-headed, and married. And so when we talk about this, we see that 24% of the households in Manatee County are single-headed households. So when we talk about that survival budget and the 96,000 that's needed for a household to be able to cover expenses, that's one person in 24% of our households who's trying to make that per year. Likewise, when we look at age, this chart is likely unsurprising, but is important for us to consider. When we look at the households and we look at that far right in the makeup of the households that are struggling the most are households with a primary earner under the age of 25, and they struggle, but there aren't many of those households in our community. Very, very close to them is our senior households, our households that have a primary earner over the age of 65. And there are a lot of them. Over 40% of the households in Manatee County are households made up of individuals over the age of 65. And we know that over half of them are struggling to make ends meet. Another way to look at this is by looking at how this is charted over time. Among our senior communities, we've seen a 62% increase in the number of households that are below the ALICE threshold. So these are individuals who may or may not have retirement savings to go along with their Social Security. We know Social Security is not enough on its own to make ends meet for most individuals. And so we're seeing older adults return to the workforce. And we can think about what effect that has on their physical and mental well-being. So while we've seen the number of households that are ALICE in other areas declining slightly, or at least plateauing in the case of those households 44 to 64, we've seen it skyrocketing among our senior households. And this is an area of significant concern for us. And then likewise, when we look at race and ethnicity, we see that our Hispanic and Latinx, as well as our Black households, are struggling significantly more than their racial counterparts. And we should be aware of that in our community and what we're doing in terms of outreach to work with them. So this big question is, okay, Nichole, you've hit me with a lot of data. I promise I'm done showing you charts and graphs. How do we respond? What can we do? And so we have 4 pieces that we think every person can do in order to make our efforts successful. First is that organizationally, we are bringing together partners from all of our areas, from nonprofits to educational sectors to businesses to support households that are hit the hardest. Talking and bringing people together, convening and collaborating with partners who otherwise wouldn't necessarily talk to each other is really important because it will take all of us to address this issue. We are also reinforcing our efforts around supporting education and financial security in our community, often with multi-generational efforts. 2 things that you can do are to educate and advocate around the magnitude of those in need. Each of you will encounter people that I will never, ever talk to. Talk to them, whether it's the kitchen table method of going home. Nearly every time my wife and I have friends over, inevitably somebody brings up housing. And I'm like, well, did you know about ALICE? At this point, my friends can probably give you part of my ALICE presentation because they've heard it so many times. Have those kitchen table conversations with your friends. Each of you is likely part of a group that I'm not part of. Share this data with them, or go to our website and request an ALICE presentation, and me or someone else on our team will come out and share either the long version that I've given you today or the short version. And finally, continuing to advocate and advance practices that help people earn enough to get by, whether that means advocating for increased wages, whether it means advocating for jobs, whether it means advocating for educational opportunity, whatever it is that's important to you, continue that advocacy work in order to help people be able to afford basic needs in the community. And with that, I'm going to stop sharing. I may have stopped. Did I stop sharing already? Oh, Tina, you are on mute.
Yeah, I still
It looks
see,
like I have.
yeah, I
Fantastic.
still see the screen, but I don't think it's
Okay.
a problem
I'm going to work on that.
Okay.
While I work on that, I'll open this up for any additional questions that you all have.
And so folks, if you want to either put it in the chat, or I think it's manageable enough that you could probably raise your hand as well. But I've got a question already. Again, so some questions. Many of we're the kind of group where many of our questions defy easy answers, but
I
yeah.
appreciate that question.
Yeah, so you see it?
So yes,
Yeah.
so
Yeah.
SNAP, how are SNAP and Medicaid reduction going to impact things? The short answer is it's going to be bad. And, you know, we already know that for our partners who are working already in our food pantries, this is of grave concern to them. We have resource centers, and we know that individuals are relying on SNAP to help them. We know that they're relying on food pantries to help them supplement their budgets in many ways. And so bad is the short version. And it's certainly something that our public policy team is looking at. It's certainly something that if you go to United Way Worldwide, they have some estimates. We also recommend looking at the Center for Budget Policy Priorities message about the proposed impacts, and as well as stuff that's come out from the Pew Research Center about them. So thank you for that. Yeah, it's not a great situation for many people.
Oh, I'm sorry. Go ahead and finish, Nicole. I was about to
Go ahead.
tee up another question. So related question, kind of related to the food pantries, was impact on school lunch programs will probably be significant as well.
Absolutely. And we know we do an Alice data walk. So if you're ever interested in something more interactive, we do an activity where it walks you through the life of an Alice household, and you're tasked with making choices. And inevitably, when individuals get to the food choice, it is the parent is sending the child to school where they know that they'll get perhaps breakfast and lunch, and they depend on that. And the parent is skipping meals in order to make their food budget stretch. We see that already with summer care and the importance of summer break spots. And so these are areas of grave concern for us.
Yeah, well, fortunately, we've got some of our education team members on this call as well, which is great. And question about you know, the Medicaid, and whether people will know that they're losing, you know, their Medicaid coverage.
Absolutely. Florida, like many states, does not call Medicaid Medicaid, right? And so in terms of our advocacy, you mentioned that it's not taking effect yet. And so if you want to be optimistic about this, there is still time to reverse it. And so educating and people about what is at stake, what potentially could be lost. Additionally, we know that a significant number of people are kicked off of federal benefit supports each year. About 60% are kicked off due to administrative errors and application errors. Yeah. And so helping individuals know that if they lose coverage, they can reapply, and there are supports in place to help them make sure that their application is correct. What else? It looks like Nina, you have a question?
Yeah, yes, I do. Thank you, Nicole, for presenting a very complex topic in a very clear and organized way. I really, really appreciate it. My question was, when I was struck by with the Alice household survival budget, the high number for transportation, $999 a month for transportation. I know you talked about the bus system being, but maybe for advocacy, looking at how we might improve our infrastructure. And I know people who rely on the bus system and complain about it. But if it were more efficient or more of it or better organized or whatever, would you think that would help?
Absolutely. So, transportation, in order to consider the bus system feasible, is based on a percentage of people who are able to access and use it. It's based on how it runs. So we look at cities like New York City, DC, even the L in Chicago, that have these massive mass transportation systems. In Manatee County, we will give them credit. There have been improvements. They have plus connections that connect individuals between the Manatee bus system and the Sarasota bus system, because we know people are moving between those two communities a lot. And so there have been improvements. And that is something that we can continue to advocate for, is anytime the transit department asks us about what we need in transit, letting them know we got to have buses run on time. People depend on that to get to work. We've got to have access, and we need to make it possible for people to use that. So absolutely, our approach is that any action is better than inaction. And so everything you say, whether it's transportation, whether it's food, if it's childcare that you care about, whatever that thing is that like keeps you up at night or gets you energized in the morning, take that and continue to advocate for that, because any improvements are going to help our Alice families.
And Nichole, I want to paraphrase a question
Thank you.
from our friend Glenn. Basically kind of, the importance of this data, and whether it's been shared with some of our elected officials. I know we have some of our county agency folks on this call and some other recent ones, but do you have any perspective on that? The city or county officials who've seen the Alice data?
Absolutely. So we are regularly in conversation with our local, state, and national officials about this. And so we talk to them regularly about Alice. But anytime you are engaging, we encourage you to also remind them about Alice. Every time we go to speak to our state legislators, I'm always fascinated, I think is the term I would use, by the legislators who we walk in and we're like, do you know about Alice? And some of them start talking to us about Alice immediately. And others are like looking at us like, I have no idea what you're talking about. And particularly with junior legislators, there's an opportunity to share with them about Alice and what that means for our community. And so like at our local level, most of our offices know about Alice, but the more we can as a community continue to use that term and continue to remind people that it's those who are at 30 to 60% AMI, those who are at 60 to 80% AMI, those are Alice, is really important to our work. And to the person who said about healthcare costs, they are low, and they are low intentionally. Every line on that budget is intentionally low. I could probably spend another hour talking to you about the methodology of it. I won't. The healthcare cost is based on a employer-sponsored healthcare program, and it doesn't include the entire household. So many households are just living on hope and a prayer. It's why when your child gets sick, if you're an Alice household, you're going, oh my God, if my child is sick, do I have to call out of work, or do I give them some Tylenol and send them to daycare, hoping that their fever doesn't go up and the daycare doesn't call me? You're saying, if my child falls and hurt their arm, we're going to put some ice on it and hope it's not broken. If my child has a weird rash, let's put some topical cream on it and see what happens, because the cost can be catastrophic for a family. But the day-to-day costs are also expensive, which means that it's a risk they're willing to take.
We've got possibly time for, a last question before we wrap up. Any kind of last kind of capstone question from anybody? I guess I would ask Nichole, in terms of the biggest needs in our community, do we assume that they're proportional to, those items that are the largest share of the survival budget? Or are there areas where, even though something is kind of a large budget item, it's something that, we as a community might be doing fairly well with? So for example, a few years ago, a study was done that we might have, and based on the survey, folks felt that we had a lot of duplication in something like food assistance, as an example.
Sure. So I'll answer that in two parts. One is that I think anything we do is better than nothing. And while there may be duplication in food assistance, the types of foods that are available to individuals may not be enough to supplement an entire household budget. Two areas of focus in our community are affordable housing. I know this is something that you all have looked at in the past. We have housing for those with the lowest incomes, and we have a lot of housing. We actually have an excess of housing for individuals who are above 120% AMI, and adequate housing for those who are at 100% to 120%. But for those between 30% and 100% AMI, which overwhelmingly are ALICE households, there's just not enough housing stock. So as somebody's wages increase, they may get bumped out of housing that is subsidized, but they can't get into housing at market rate. So affordable housing is an issue that we can coalesce around. And the other one is childcare. We don't have enough childcare providers in Manatee County, and the childcare slots are incredibly expensive. I mentioned this once and I'll mention it again. It is cheaper for me to send my daughter to a state school, a state college or university, than it would be to put her in childcare. My friend jokes that they're going to send their son Roman to college because it's cheaper than having him go to daycare. And so those are two areas that are really impacting our community. The childcare cost, of course, not only impacts the families with children, but our other families in our communities as a whole. Childcare is a workforce issue, because if you can't afford childcare, at some point you're doing the math and saying it is cheaper for me to stay at home with my child than it is for me to send my child to childcare and go to work.
Thanks, Nichole. That really gives us some more context.
Absolutely. I want to thank you all for allowing me to be here today. Someone asked about other counties, and I would encourage you to go to our website, unitedwaysuncoast.org. You can click on our homepage. There are two key pieces on that. One is the ALICE report. You can get it for each individual county. You'll also have a copy of this presentation. You can get it for our 5-county region. You can see it for the entire state of Florida, or you can go and compare it to another state and see how we're doing compared to another state. Lots of information on our website. On that website as well, you can request an ALICE presentation. So if you liked my ALICE presentation and you want it to be given to another group, you want it to be shorter, we can do that. If you like the data and you want somebody else to present it, somebody else can come present it as well. But we're always happy to talk to more groups about this and share that with others. So somebody asked, I'm going to put our website in the chat, or actually, I think my colleague Crystal is on here. Crystal, if you can snag that for me. And we'll make sure it's in the presentation, so we'll make sure you have that
Yeah.
for the day.
Tina, let me just say, a wonderful presentation, but if I can get either from Tina or from you, Nicole, any links that you want to share, what I'm going to do is post this on YouTube, and then we will both have it on our YouTube channel, and we will send to anybody that registered for this the link to the video. But if you could also give me any links that you would like to share with them in terms of your website, in terms of the Alice report, or anything else, just email it to me. Thank you.
And it's in the chat already, which is great. At least the main address. Thanks, Nicole. Yep. So